Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could be here with us. For our next guest, the distinguished Dr. Paul Tocchet, family practitioner here in Carmel Valley. Dr. Tocchet, thanks so very much for being on my program.
Thank you.
We're very lucky to have you. Dr. Tocchet, before we get into talking about hypertension, which I think is an incredibly valuable topic for us to discuss, let's talk about you a little bit. Let's talk about your training and where you're from and what your practice is like.
Well, I'm in family practice. I've been in family practice in Carmel Valley for some 40 years.
40 years?
Yes, yes.
That's amazing.
Yes.
I mean, that's multiple generations that you've probably seen grow up and stay well and sometimes get sick, and it's amazing.
It's been very exciting.
40 years.
Yes, yes.
You probably know most of the town, most of Carmel Valley.
Probably.
Amazing. So tell us about your training, Dr. Tocchet.
I'm from Pennsylvania. I went to Temple University and spent a few years in the service, challenged the boards for family practice, came to California in the service, and started practice in Carmel Valley in 1969, have been there since.
Okay, so what branch of the service did you...
I was in the Navy.
You were in the Navy?
Yes.
For how long?
4 years.
4 years. As a physician?
Yes.
Excellent. Okay, well, Dr. Tocchet, and now you're a family practitioner, family
Yes.
practice, family medicine.
Yes.
And your office is in Carmel Valley.
Yes.
Okay, so what I want to learn about, and it's been some years since I attended medical school, as we all know, I want to learn about current concepts and treatment of hypertension, high blood pressure. So I wonder if it would be valuable to talk about the numbers that we talk about for hypertension and talk about blood pressure. Now, there's two numbers. There's systolic and there's diastolic, right?
Yes.
So
yes.
Can we talk about that?
Yes. Hypertension, as you know, the correct term is essential hypertension, only because we really don't have a real significant cause for hypertension, so we use the term essential. The numbers that we try to state as a normal blood pressure is 120 over 80. 120 is the systolic, 80 is diastolic, and that's the ideal blood pressure for anyone as far as the American Hypertension Society recommends.
Okay, so there's, if we say 120 over 80, the first number is the systolic, and the second number is the diastolic, correct?
The lower number is the diastolic, yes.
Okay, so can you teach us what the difference is and what those numbers mean, what the pressures mean?
The systolic, which is the top number, reflects the amount of pressure going through the arteries and through the body. The diastolic, which is the lower number, reflects the end result of the effects of the heart, which is the end result of the pressure having gone through the body, and the diastolic reflects what's going on in the heart.
Okay, so the first number, for example, in 120 over 80, the 120 is the systolic. That's like the head pressure. That's the degree of the pressure that's being pushed, right?
Mm-hmm.
The
Yes.
blood is going forward at a pressure of 120, right. And the 80 is sort of like the resistance that the body is giving back. Is that right, or the sort of back pressure?
That's probably a good way of putting it. Yes.
Okay.
Yes.
So you said that 120 over 80 is ideal for anyone.
That's the ideal that we're striving for, yes.
Okay, so how does the ideal get out of kilter? I mean, what happens with high blood pressure?
Well, as I said, we really don't have all the mechanics worked out as to what really causes high blood pressure. There's primary hypertension or primary high blood pressure, which is somewhat of a mystery. Something goes wrong in the chemistries of the body, the blood pressure goes up, the workload on the heart goes up, and you have hypertension. Secondary hypertension is the blood pressure that goes up consequently to some other disease or manifestation of some illness in the body. For instance, if you're on steroids, that has a tendency to raise your blood pressure. That would be a secondary form of hypertension. If you have other drugs in your system, amphetamines can raise the blood pressure, so that would be a secondary thing. The primary cause of hypertension, which is right now somewhat of a chemical aberration, still undefined specifically, is the one that we're concerned about.
Okay. So when you say essential hypertension, that could mean, for whatever reason, kind of a primary cause that the blood pressure gets too high.
Yes.
Now, are we talking about high blood pressure being the first number, or the second number, or both?
It's both. We'd like to see both those numbers at 120/80 or close to it, so that when both numbers are elevated, we're concerned about the effects of the pressure going through the body and the effects of the, as you said, the back pressure on the heart, so that both numbers have a meaning.
Okay, so if someone has high blood pressure, well, before we get to if someone has it and needs treatment, if I go out and play a basketball game, or if we were to get excited for some reason, isn't it normal, physiologic for our blood pressure to go up, or is that not correct?
Yes. Raising the heart rate, exercising, doing things, stress will raise your heart rate and also possibly raise your blood pressure. More than likely after a handball game or a basketball game or something where you're really vigorously doing something physically, your blood pressure will go up. However, it will come back down at a reasonable time. And that time, I don't have the exact number for that, but you would expect it to come down usually within 10 or 15 minutes. In a hypertensive person, the blood pressure starts off being elevated. It's starting, at the time of rest, and then with exercise, it goes up very high and may not come down quite as quickly.
Okay, I see. So what is the problem with having high blood pressure? Why do we need to treat someone who has hypertension?
Well, primarily it's just the entity itself of pressure, high blood pressure. It would be like taking a garden hose and putting it at full blast. The pressure has more erosive properties as to what it hits, as opposed to low pressure if you turn the faucet down. Well, this applies to the brain. The end organs, which are the brain, the kidneys, the liver, the eyes, as there is greater pressure going through a narrower conduit, which is one of the problems of hypertension, is that the conduit, the arteries, constrict so that there's greater pressure. The flow coming out at the end has a greater velocity or greater pressure, which can cause more damage to that part, which is the entire body.
Okay, so for example, you mentioned the kidneys. If someone has long-term high blood pressure, untreated for many years, what can happen to the kidneys?
Well, the biggest problem, of course, with end-organ kidney disease is that there's kidney failure, which is a destruction of the actual parts of the kidney, start shrinking or breaking down so that the actual function of the kidney deteriorates. And with that deterioration, then there's a buildup of all types of waste products, which can add to their own respective problems. So kidney disease is one of the major problems that we see with hypertension, as are the eyes, the heart, the brain, etc.
Okay, so what about the heart? If the heart itself is pumping too hard or the pressure is too high, what happens to the heart itself?
Well, first of all, the heart itself is a pump, as you know, a mechanical pump made out of muscle. And as the blood pressure remains elevated, the pump has to work harder. And as it does, like any other mechanical pump, the increase in pumping activity causes a greater wearing down of that pump. So not only do you have the mechanical wearing down of the muscle enlarges to compensate for this, which is detrimental. As the muscle enlarges, the chambers function less efficiently. And secondly, with the effects on the circulation to the heart, there's also a greater effect as far as the circulation, causing an increased chance for heart attack because of the increased pressure effects on the circulation in the heart muscle.
Okay, so simply by having untreated high blood pressure for a long time, that can lead to an increase in the incidence of heart attacks. Is that right?
It can, yes.
Okay, so, I don't remember, did you mention brain? Did you mention the effect on the brain? Can't people have a higher incidence of strokes or CVAs with hypertension? Isn't that correct?
Yes. Yes, hypertension is one of the leading causes of stroke. And this is due to, again, end organ deterioration. With the greater pressure of the circulation going through the arteries to the brain, there's damage to the circulatory part of the brain and the actual functioning part of the brain because of this, which leads to either blood clots, narrowing of the artery, forming clots or thrombi. There can be just wet clots with rupturing of the arteries causing hemorrhage.
Okay, now Dr. Tocchet, I'm still trying to understand the difference between the systolic number being too high and the second number, the diastolic being too high. Now, if either of those are too high, can that lead to heart disease and heart attacks and kidney problems and strokes, or is it one or the other?
Well, generally they go hand in hand. In other words, the systolic and the diastolic go up in hypertension. It may be more accentuated in different age groups or in different ethnic groups. The hypertension numbers may be a little bit different as far as the number between the top number and the bottom number. But the thing here that we're still concerned about is the elevation of the top as well as the bottom number. Both have to be corrected with changes of lifestyle or medication.
Okay, so that's a perfect segue. Everybody wants to know about if they have a condition, or whether it's high blood pressure or diabetes or anything else. People want to know about treating something without medicine and without going to the doctor so often. Are there lifestyle changes or diet or weight or activity, stress? What can people do to bring their blood pressure down? Is it possible for people to treat high blood pressure without medicine?
Yes, it is. It is possible. In fact, I think most people who are very interested in being healthier will do it with lifestyle changes. And that primarily involves weight, nutrition, exercise, stress reduction, and managing any other medical issues that might be consequent or related to the blood pressure. And that, of course, would start with nutrition and weight reduction, salt restriction. And if these types of changes don't make appreciable decrease in the blood pressure, then medications would be considered.
Okay, Dr. Tocchet, let's talk about some of those other lifestyle changes that people can perhaps make. People can make. You mentioned weight and salt intake, and I think you mentioned stress.
Yes.
So can we talk about some of those issues about how they're involved with controlling high blood pressure and controlling blood pressure? I
think after the evaluation that the numbers are a bit elevated, the average person who seeks medical attention would probably have a review of their lifestyle, their eating habits, their exercise habits, their alcohol, salt, tobacco, or other smoking activities. And all of these things have a bearing on hypertension. If someone is overweight, we would start them on an exercise program, gradually, of course, with weight reduction and caloric restriction. If they are salt users, as most people are, because everyone likes good tasting food, the first restriction would be to find out what the salt source is and restricting that. Salt has a very major bearing on reducing blood pressure.
Well, Dr. Tocchet, let's pause for just a moment. Now, why is it that high salt diets seem to increase the incidence of high blood pressure? What is it about salt?
Well, I believe that salt, as you know, is something that gave food a taste. From the Dark Ages on, we started to eat better because we salted our food. However, I think we really got carried away. The increase in salt increases volume, and the increase in volume increases pressure. So that by reducing that, it would certainly have a meritorious effect on reducing the blood pressure.
Okay, so I think that if there's increased salt in our blood circulation, then we naturally hang on to more fluid and hang on to water.
Yes.
Right? And
yes.
Which increases the volume within that pump and within that system, and so the pressure goes up, as you said.
That's certainly true. There may be some other issues with salt that I'm not really quite expert at telling you, but I think that there are also some other chemicals affected as far as the electrolyte balance. In other words, you can have normal blood parameters with salt, sodium, potassium chloride in your body on a blood test, and still have excessive salt that would require restriction to lower blood pressure.
Okay. And Dr. Tocchet, what about things like weight, you mentioned, and stress level, and exercise and smoking? I mean, those sound like pretty basic, but perhaps very difficult activities or parameters to get under control. Isn't that true?
There are habits that have to be corrected, and they are difficult, only because all of these things are readily accessible. But weight reduction and exercise are the two main things that I usually stress, only because they go hand in hand. If you're exercising, you don't have time to eat, and if you're eating excessively, you don't have time to exercise. So we obviously want to hit those two. The habits, as far as alcohol, caffeine, tobacco, or other smoking products, they all have a bearing as well and are very important to contain that.
Okay, so you will see someone in your office and counsel them about their hypertension, high blood pressure, and you'll counsel them about lifestyle changes, weight, and avoiding stress, and exercise, and salt, etc. Some people can respond to respond very well to the advice you give them. Some people are unable to. At what point do you encourage someone to take medicine to control their blood pressure?
Usually, if there are no other serious problems to be concerned about, if it's strictly a hypertension problem in someone who's otherwise healthy, I think it's reasonable to give a period of time of 4 to 6 weeks with lifestyle changes to see if you can make an impression on their blood pressure. If at that point they're either not complying, or it looks like even with the compliance that their blood pressure is not coming down reasonably, then medication would be considered.
So Dr. Tocchet, we have maybe a minute and a half left. Can you give us a summary of how you choose the medical regimen, what medicines that you might recommend? What are some of the most common treatments that you would prescribe for hypertension in terms of medicine?
Okay. If the activities that they have tried without medication are not productive of good blood pressure reduction, the first class of medications that we usually recommend is starting off with diuretics. Diuretics have been time proven. They've been around for a good many years. They're inexpensive. They're easy to take. That's probably the initial class. Then we have other classes such as beta blockers, calcium channel blockers, ACEI inhibitors, ARBs, which are initials for long-worded chemicals, which are the medications that we use in conjunction with or alone in controlling blood pressure.
Dr. Tocchet, so we want to teach our audience. So you talked about diuretics. So I think that means that people will pass their water more often, or they will be less likely to retain fluid. Isn't that correct?
Yes. Diuretics have a direct effect of reducing salt and fluid, but also have antihypertensive effects as far as relaxing some of the smooth muscle in the arteries to allow a reduction in the constriction in the arteries as well. So they do have antihypertensive qualities as well as diuretic qualities.
Well, Dr. Tocchet, in summary, how successful are we as the medical community at treating hypertension? If someone is compliant and willing to make some lifestyle changes and perhaps go on medicine, are we able to treat hypertension successfully?
Yes, we are. I really feel that the medical profession, probably as well as our patient, we might be a bit lax on not trying to get to the 120/80 number. Some of us settle for 135/80 or 85. We might be eager to just perhaps maybe let it go a little higher, only in as much as we're trying for short-term goals, but we still should try to get to 120/80 in everyone.
Dr. Paul Tocchet, family practitioner, family medicine, I'm delighted to have you on the program. You're practically an icon on the peninsula. You've been here 40 years, and I hope you're around and helping us to take care of patients for 40 more.
Thank you.
Dr. Tocchet, thanks so much for being here. Dr. Paul Tocchet, Carmel Valley Family Practice, Family Medicine. Thanks for being here.
Thank you, David. It's been a pleasure.
I am Dr. David Morwood. This is Your Health television program. We're going to take a very brief pause for a good cause. We're coming right back. Thanks so much for being here.